Thank you so much. But first, before starting, can you think of an organization who produced the largest amount of guidelines in the world? Do you, well, when I'm speaking, maybe you can guess, but actually, WHO is the largest guideline producer in the world. And today, my presentation hopefully provides a bit of illustration to the talk that Holger gave you earlier, and putting the guidelines in the context of making the change and the impact on country level and how it supports the work, but also a parallel journey for inspiration for the Czech Republic and others as well, on how you improve the work on guideline development that you have already made excellent progress in this, but really putting this in the wider context, the work that we do in WHO, and telling a bit of story. So let me see if I can make the slides move. The green, the big one. Okay. So first, let me introduce a bit of what WHO is and why we need the guidelines, and also how to ensure that our guidelines are trustworthy to improve our health of populations, but also how we can make the guidelines more impactful on country level and what we do for that. So first, a bit of reminder of what WHO is, what we do, and why the guidelines are important for us. So our mandate that is set by our member state is to improve the people's health in all countries, so be it in Czech Republic or in Tajikistan. But this is our mandate. It's not about producing guidelines, but guidelines are to support us. And just a reminder of how broad the scope of our work is, covering all countries under 6 regions, and we are in the WHO European region, based in Copenhagen is the regional office. And the scope of our efforts is not only to improve the population health, which is physical, but also it's very broad range of efforts that we need to put in place in terms of improving the health, which means physical, mental, and social well-being, but also making sure that all people's benefits of medical, psychological, as well as related knowledge is available and for them. And this, our constitution really, is built on 3 core functions which are interrelated. And one of the key ones that I want to focus most on is the setting norms and standards to promote and monitor their implementation. So it's really building on being the research agenda, being the convening power and engaging partnership that is critical for health. But this all is supporting our work on providing policy options, evidence-based policy options. And in order to make that impact, also work on countries to provide technical assistance to catalyze the change, but also monitor the health situation and trends. So it's kind of broader package where guideline, which we call as norms and standards, build a critical part of the building blocks. And when we talk about the guidelines, the norms and standards function, it's really what we consider our unique function and strength. There is no other UN agency or international organization with such a breadth to cover the broad range of health topics. And it really underpins the constitutions that our member states expect from us. And as you can see, then the guidelines is just one selection. And I wanted to show that the areas of work that we provide health guidance that is of evidence-based is not only of clinical care. This is also the WHO Consolidated Guidelines of Tuberculosis is including the clinical questions, but also public health. But we have very broad guidelines for physical activity, housing and health guidelines, but also on focusing on health systems. So we can say that the areas we cover, the guidelines provide norms and standards are healthcare, public health, policy, health systems, on many of the questions that are critical to reach the SDGs, as Zoe talked earlier about, and are important to provide policy advice and lead the change in countries. But how do we get these guidelines, these norms and standards? And because if we want to ensure that countries, people follow these guidelines, then we need to make sure that these guidelines are trustworthy. But how do we know? How do we know that they based on the best available evidence? Holger talked a lot about the conflicts of interest and biases, and how do we ensure that when we put out a guideline on reducing sugar intake, that the sugar industry or confectionery industry is not going to challenge us, because all our guidelines are facing increased scrutiny because they are followed. And the sugar guideline, sugar intake guideline, I did not bring out just randomly. It was scrutinized by big companies that are questioning the validity of the methods. But also, do we cover all the important stakeholders whose lives the guideline will be affecting? Have the other factors that we talked earlier, consider, are they implementable? What are the equity considerations? So if we are not considering all the questions and we don't have the answers, what would be the impact? What would be the result of that guideline? So, and from our point of view, we see that the implications may not only be related to the one guideline, but it also affects the whole range of different aspects, such as like the guideline, it won't be implemented if it does not get buy-in from different stakeholders, or if it's not just feasible. If we have made some significant flaws in terms of taking into all the important evidence available, we can cause health harm, which is rather large if we take the global scope. We waste resources, but also the scrutiny and reputational risk that if we fail in one guideline, then all our efforts to provide policy advice will be significantly threatened because, yes, you failed with this one guideline, it was flawed, what about the others? So we feel that this is where we are in facing all the scrutiny, and that's why we need to ensure that in order to fulfill our mandate and reach the SDG goals, we need to really invest in ensuring that our guidelines are trustworthy. Just looking back years ago when the guidelines were developed, I think it's a journey when going back in some countries where the also guidelines were produced in the GOPSAT method. It's the good old boys sitting around the table, bringing their evidence and discussing and agreeing on the recommendations. And in 2007, an article was published in Lancet of using evidence in WHO recommendations, and that concluded that our guidelines are not based on best available evidence. We don't use systematic reviews, relying on experts, as well as the implementation side of the guidelines were largely unattended. So that caused the need to significantly address this serious potential reputational risk, and also to ensure that we are living up to the goal of being an evidence-based organization. And it started with establishing the Guidelines Review Committee, whose member I'm also as a representative of the WHO Regional Office for Europe, which is tasked to develop and implement standards and procedures for guideline development, as well as provide oversight of all the guidelines that are produced by WHO. Also, the guideline handbook was developed, which is aiming to, that we aim to meet the highest international standards, and that we produce recommendations that are trustworthy and implementable, which is extremely important. And through that, minimize bias, focus on end user, be explicit and transparent, based on best available, as well as be usable. So basically, really following what Holger talked earlier. We have changed significantly the methods and processes to be explicit and transparent, using GRADE and other tools, having concrete scopes, objectives, and target audience, paying a lot of attention on the funding and managing the conflicts of interest, as well as reporting. And the recommendations they are still based, the consensus. They based on best available, up-to-date evidence. We produce systematic reviews to or commission them to inform the recommendations, have a rationale, and clear linkage with the evidence to recommendation, and be articulate and precise. And we have a system of checks and balances is placed. I'm not going in depth there, but it really follows that we aim to involve relevant stakeholders, independent experts, having strong support also internally, and clear development processes, thinking through on how every aspect is covered to ensure that our guidelines are rigorous, transparent, and based on best available evidence, as well as covering relevant factors that influence the recommendation and are important to consider during the judgment process. And so, if coming back in thinking how far we actually have come, so this is what we used, and now we have improved the methods in terms of minimizing the bias, making them explicit, and covering the relevant criteria that Holger talked about, in ensuring the guidelines are really living up to the aim of being under the international standards, and ensuring that they can be implemented. But how we can ensure their impact? May our work, the policy advice, technical assistance, being a convening power and leader, is exemplified and detailed out in our global program of work, which promotes health, keeps the world safe, and serves the vulnerable. And so guidelines and our norms and standard setting products are one input to the larger impact, which is the improved health outcomes. So we see that is a continuum. But if we look at our country, so WHO Regional Office for Europe covers 53 member states, from Iceland to Tajikistan, and the countries are very diverse in their population size, the population health needs, the population composition, also the health systems are different and resources are different. So how can we provide recommendations for all the countries that are implementable there equally? Obviously, there are recommendations, there are strong recommendations and are applicable to everywhere. But what about the conditional recommendations that are dependent on contextual factors, the availability of resources, the baseline risks, the feasibility arrangements? So these are the, just, you know, if you're looking at the numbers, these are the latest that I found in WHO database. So just a disclaimer here, it's for illustration purposes, so you don't need to go into detail, but you can tell me if something is really off from Czechia. But this is to show that in some cases, countries really need to look into either our recommendations and guidelines or other international ones, because WHO guidelines, although we are the largest producers, we are limited in terms of the questions that we provide advice on. We also have understood, and there is is still room for improvement in terms of awareness and understanding of evidence-based principles and guidelines, as well as having the supportive country culture, as well as the resources are different availabilities in both in human and health, as well as the methodological and support and guidance differs. So, and to support countries in putting these guidelines, their recommendations in practice, allowing for contextualization, which means taking into consideration what can be changed, what should be changed in the recommendation, but still leaving them as trustworthy. We have developed, based on our work in countries, as Holger mentioned earlier, in Estonia, but also learning from experiences that Miloslav has had, as well as building on international standards. We have published a handbook on strengthening countries' capacities to adopt and adapt evidence-based guidelines. So go on giving countries an overview of what should be done and what can be done and what needs to be in place in terms of ensuring that when you are to adapt contextualize a guideline, what needs to be done in terms of the processes, methods, and involvement of different stakeholders. And if we think of that, why we do need to take a recommendation that is developed elsewhere and not only put it in the practice of a country, then there is a need to think through what is the local available evidence and involving the local stakeholders to discuss that in terms of the conditional recommendations and thinking through how it is applicable in terms of the feasibility, resources, and other aspects that may be requiring modification of that recommendation, and therefore also increasing the possibility of implementation. But in doing so, require the application of structured and transparent processes. And what we see is, if you don't understand and take into consideration of the local context, local stakeholders, it is very hard to ensure that the recommendations can be implemented. And we also had a good meeting in UNCT Copenhagen to start thinking together with countries and Czech Republic and others who were present, and you have more people there to really build country capacities in terms of how to adapt and adopt recommendations, guidelines into country context using systematic and transparent and structured processes, and building that capacity to support others and networks. So, and also some aspects that what can and should be done is that we really, need in collaboration with other partners that are also here to build that culture of evidence-informed decision-making, evidence-based medicine through synergies and capacities and the community of practice to really appreciate and follow the principles of evidence-based medicine and guidelines. But also that we see the need to provide support for implementation through the ways on how we adapt guidelines. And also earlier there were discussions on institutionalization, which is the main goal of providing the methodological support for the ensuring that the guideline development is structured, systematic, and trustworthy, as we have also seen through the experience from WHO that having concrete processes, methods, and structures in place really allows improving the quality and trustworthiness of the guidelines. So this is something that we can learn and take away. But also, the guidelines are not something that they are separate. The recommendations need to be interlinked with the health system and governance reforms and with quality of care and decision making. And just as a final slide for summary, is that WHO is a norms and standard setting organization and setting the guidelines and developing guidelines for the world. But we have been going a long way to improve the methods and processes to really ensure that what our guidelines are recommending are trustworthy and implementable. But we also consider and understand that the guidelines are not, without country context and setting, and they need to be they need to be thought and discussed through on a country level, taking into considerations the context, contextual factors to ensure the implementation. But for doing that, the capacities in the countries need to be strengthened, and we have been starting to work on that front through producing tools and building a capacity strengthening into our our work program to support countries. But we also are very happy and very pleased that we can rely on the work that Miloslav and his team is doing, and because countries are looking also at other countries' experiences and learning from, because it is something that can be like intimidating a bit, because this is a hard and complicated, and sometimes it is like a philosophical. You have to really, be a visionary, and we need those examples, and who are willing to take the leap and champion the way. And because we have also seen in some other countries that this is possible. We have seen in Estonia, where they established the guideline program in 2010, and that it is possible to bring also the skeptical clinicians, health providers along, but it takes time, and for that you need to have courage and also resilience and persistence in continuing. And we are very happy to support also Czech Republic, Czechia, still sometimes skipped, but and thank you for the attention, and thank you for inviting me here.